Hello, my name is Professor Alpaslan Şenköylü. And welcome to our new program about your health problems. And actually we're gonna answer 10 questions about disc herniation. The first question is, what is the disc herniation? Disc herniation is a broad term describing specific changes in a lumbar disc. A disc is a soft, rubbery structure located between the vertebral bodies. It's a kind of actually articulation between the bones. The disc acts as a pad or cushion for the bone. The outer portion of the disc, the annulus fibrosus, is made up of a tough fibrocartilage. The middle section, we call this one is a nucleus pulposus, composed of water and collagen and has a gelatinous, jelly-like actually consistency. Some people describe the disc structure as resembling a jelly donut. The disc allows for movement of the vertebral bodies and provides a buffer for compression between the bones. Normally, this system works very well. When a disc herniates, however, there has been a tear in the annulus fibrosus and some of the gelatinous center comes out through this tear. These herniations are described by their size as follows, like bulging, the small one, protrusion, slightly larger, extrusion, the bigger one, and sequestrated fragment, which means the sum of the material has broken off from the disc. Once the disc has left its original anatomical position, the disc itself can be painful. It might irritate a nerve or it may contribute to narrowing the spinal canal. The second question will be what is the reason of the disc herniation? It's actually mostly inherited. If your parents or siblings have a disc herniation, probably you will have too. Other reasons are repetitive trauma, like people who are using road perforators or long-distance drivers, etc. And acute trauma also may cause disc herniation. The third question will be, I have an MRI report that says I have 3 herniated discs. What does that mean? There are 2 parts of this answer. The first one is, it is quite common to have disc herniation in the lumbar spine. In studies looking at people without back pain, a large percentage have had disc herniations that do not cause their back or leg to hurt. The second, the term disc herniation is very broad. Herniation is a good if broad term is describe a change in the disc. In many ways, it's a generic as saying you drive a car, but that car can be a compact car, a sedan or a station wagon or a large SUV. The same goes for disc herniations. They can be disc bulges, protrusions, extrusions, or sequestrated fragments. As they get bigger, they involve more symptoms. The fourth question, I have back pain and an MRI showing a disc has herniated. Do I need a surgery? This is an excellent question, and there is a good answer. There are 4 reasons to seek a surgical solution. First one is cauda equina syndrome. This is a disorder affecting a bundle of spinal nerve roots, which is extremely rare and requires urgent surgery. This syndrome includes back and leg pain, weakness and numbness, and may be associated with problems with bladder and bowel function. Progressive strength loss, the second indication for the surgery. Many people have some strength loss, but if it is worsening, this would be an indication for surgery. The third indication for the surgery is intractable pain. If your pain cannot be controlled with medicine, injections, or physical therapy, then this too would be an indication for surgery. The fourth indication for the surgery is failure of conservative care. If a comprehensive program of physical therapy, medication or injection has failed, then you might be a candidate for surgery. Our fifth question about the disc herniation is, what happens to my disc herniation if I don't have surgery? This question was answered in a very elegant study. In patients with different size herniations, like bulges, protrusions, extrusions, were assessed with a MRI or CT scan, and what they found was in this study by a 6 months and 2 year herniated disc material had dissolved in many of the cases. And the larger the herniation, like extrusion or sequestrations, is faster the material was reabsorbed. And long-term studies have shown that although surgical intervention may generate a faster initial recovery time, conservative so-called non-surgical treatment outcomes are equally effective in patients after 5 and 10 years. So that means if you don't have any surgery, don't worry about it. But the problem is if you have a cauda equina syndrome, which means if you have a kind of bowel or bladder dysfunction, then you need exactly have a surgery, otherwise it's sometimes irreversible. Our sixth question is, why do I feel pain in my leg if the problem is in my back? Another good question. The nerves that go out the legs come off the spinal cord. And as they come off, they run in the spinal canal and then come out between two of the vertebral bodies. When they are in the canal, they are named by the associated disc level, like L5, L4, L4-5, L3-4, something like that. When the nerves come out the individual levels, they group together to make up named nerves. For example, the sciatica nerve or femoral nerve. It's in the canal that disc irritates the nerve, sending pain down to the leg, corresponding to the disc involved, and the side of the nerve that it irritates. Let's say, if you have a compression at the right side, that means you can have a referred pain to your right leg, or vice versa. The seventh question. If I don't have surgery, what are my options? There are a lot of options for non-surgical treatment of low back pain and, of course, disc herniation. The first is physical therapy. Good physical therapy will allow for the disc to heal and to provide improvements in biomechanics and strength. Recent studies have shown that directed physical therapy is more successful than more random approaches. Often this is enough. When the pain is too much to try physical therapy, however, epidural steroid injections can also be very helpful. Epidural injections are safe when compared to more invasive procedures. And complications include bleeding, headaches, infections, and we may have seen very rarely. However, pain reduction can be markedly improved. Studies have shown excellent pain reduction and return to function with the use of epidural injections and nerve root blocks. The combination of these two techniques can be the most effective treatment of all. The epidural provides pain reduction and makes the physical therapy that much more successful. Our eighth question will be, how can I prevent repeated pain attacks? Regular exercises and weight loss should be started as soon as possible after the first attack. Pilates, swimming, yoga are satisfactory exercise types for strengthening core muscles. Let's say if you have a tummy, your actually weight switch to the anterior front and your back loaded too much. And you need to lose your weight just after the first attack. Our ninth question will be, do you suggest a specific exercise type? This is another very good question. Actually, most of my colleagues they recommend swimming to all of my patients. But the swimming, you need to actually, in Africa, of course, you may have a very good sea source or some lakes and some rivers to swim, and the weather is hot enough. But if you are living a place without any water source, how can you swim? So, as I mentioned before, Pilates and yoga, you can do everywhere, individually. And this is the actually very good exercise for your core muscles. I always say to my patients, the best exercise is the one you most enjoyed. So if you enjoy with the exercise, then you motivate and you do regular exercises, because the key word is the regular exercises in order to prevent the attacks of the pain. Yes. The last question is, do I need the bed rest after pain attack? Another very good question. And most of the colleagues refer the patient to the bed rest, which is actually, you can use this one as a limited manner, let's say 1 or 2 days. But if you continue to bed rest, then your muscle become weak, which is not good for you. You should keep bed rest very short. And we use cognitive behavioral therapy. And this approach will help the patient to cope with his or her illness behavior. Thank you very much and stay safe until the next program.